co-founders here at Public-Private Strategies. Right?
Wonderful. Well, thank you so much, Renee, and hello, everyone. Welcome to this amazing event today. What I wanted to do was start by telling you all a little bit about Reimagine Main Street. When COVID-19 first happened, we knew that we needed to respond quickly. And so we brought together an amazing group of individuals from all across the economy to respond to make sure that small business owners and their workers were at the center of COVID-19 recovery. To date, over the past year, we have convened several important convenings. We've released lots of new research that's helped illustrate the problem, and we've met with a variety of policymakers. Today, we're taking an additional step, which is we're going to be moving to doing outreach, direct outreach to business organizations and business owners around vaccinations, because we know in order to build our economy back better, this is an all hands on deck effort. And we know that small business owners are such an important part of the fabric that makes our country and our communities, and they have an important role to play. Before we hop in today and we hear from an amazing set of business owners and a special guest from the Biden-Harris administration, I want to thank all of our partners who made today possible. Today, we're going to be doing a variety of things that I'm going to talk about, but I want to say thank you to the National Asian Island American Chamber of Commerce and Entrepreneurship, the U.S. Black Chamber of Commerce, the United States Hispanic Chamber of Commerce, Women Impacting Public Policy, the National Association of Women Business Owners, the National Gay and Lesbian Chamber of Commerce, as well as many other important organizations who are on this phone today. We have chambers of commerce from all around the country who've stood up today. Let me just quickly tell you about what we're hoping to tell you a little bit about today and what we're hoping to achieve. So first, we're going to release results from a survey of over 3,000 small employers, better understanding how they feel about vaccines and vaccinations and the important role that small business owners can play. And we're going to hear a little bit about that today from our colleague, Tammy. Also, today, we are so excited to announce the commitment of over 400 small business leaders who've decided to step up in their community and to take action, both for their employees and in their community, to help to make sure that we're getting vaccinations in arms that will help get our economy back and allow small business owners to do what they do best, which is grow jobs in our communities. We're going to hear from an amazing panel today of business owners from all around the country, from the middle of the country, from the West, to hear what they're doing on this important effort. So you'll hear from some small business owners directly. And then lastly, today, we are launching an education and outreach effort. So this is just one of many events that we'll be doing today on our website, reimaginemainstreet.org. You can go and visit, and you'll see that not only do we have the commitment that we announced today, and we encourage business owners to sign up, but we're launching a whole bunch of free tools and resources, including tip sheets in several languages, Spanish, in at least 3 Asian languages, to make sure that every small business owner who wants access to tools and information about how they can play an important role to get more vaccines, more vaccine education and more vaccinations in people's arms, they can play a role in doing so. So with that, it's my pleasure to turn the conversation back to my colleague, Renee Johnson, who's going to walk us through some very quick housekeeping before we turn over to the research review. With that, Renee, back to you.
Thanks, Red. So if you have any questions during any of the times, we would love for you to use the Q&A function down at the bottom of your screen. Just go ahead and use that function, the chat function, and the Q&A, and type in any questions that you may have. Additionally, we want to let you know that this session is being recorded and that you will also get a copy of this too in your emails later on. Additionally, we are live streaming this to Facebook. So we want to say hello to all of our friends on Facebook and that this will also be living there too. So you can also review it there as well later after today. Want to also go into the next session, which is going to be by Tammy Halevi, our senior advisor here at Public-Private Strategies, who's going to talk more about the release of the survey. Tammy?
Thanks, Renee. So no one in this audience needs to be reminded how hard COVID-19 has been on small businesses. And hopefully we all agree that vaccines are a critical step in getting Main Streets and MLK Boulevards back to business. Our team at Reimagine Main Street is excited by all of the efforts designed to overcome vaccine hesitancy and get people vaccinated. But we saw that most of these efforts were focused on individuals and employees of large enterprise. We thought that that approach might miss the opportunity to reach the roughly 30% of people in the US who own or are employed by a small business. and maybe even more importantly, to benefit from the deep trust that communities put into their small business owners. So we wanted to understand what small employers thought about vaccines and vaccinations. In partnership with National ACE, the U.S. Black Chambers, Inc., and the U.S. Hispanic Chamber of Commerce and PPS, we fielded a large survey of small employers. So from February 3rd through March 23rd, we had an online survey distributed through the networks of our survey partners. As you can see, this effort yielded 3,223 responses from small employers, including 428 AAPI business owners, 1,172 Black business owners, which represents about 1% of all Black small employers across the country, 520 Hispanic or Latinx business owners, 89 Native, and 1,200 and some white business owners. This afternoon, we're presenting an overview of the survey and just a handful of findings. The full survey report is available on the reimaginemainstreet.org website. So, what did we find? The survey is rich with nuggets, but we think 3 points warrant focus. First, vaccines are on the minds of most small employers and their employees. The majority of small employers say it is very important that their employees get vaccinated, and more than half of small employers say their workers are turning to them with questions. Small employers want their employees to get vaccinated so they can get back to business, and they are willing to make it happen. The majority of respondents are willing to encourage and incentivize their employees to get vaccinated, with AAPI and Black small employers the most likely to act. And finally, small employers told us they wanted science-based guidance for their employees and their community, and they're eager to work with trusted partners. Let's dive in. So, as you can see, most small employers think it's important that their employees get vaccinated. Overall, 87% of all respondents assigned importance to employees getting vaccinated, with 64% indicating that it's very important or critical. AAPI and Latinx small employers were most emphatic, with 79% and 70% of respondents respectively assigning the highest importance to vaccines for their employees. Not only do employers think that it's important for their employees to get vaccinated so they can get back to business, but workers are turning to their employees with questions about vaccines. Overall, half of small employers reported that their workers were asking questions, with Black small employers reporting the highest rates of inquiry. It's also interesting to note that AAPI, Black, and Latinx small employers report frequently getting questions from their workers at rates more than twice their white peers. This may reflect the high degree of trust the employees of these businesses place in the business owners, or it may reflect the absence of other trusted sources for information about vaccines among these workers. Not surprisingly, with small employers placing great importance on vaccines and their workers asking questions, more than 80% of small employers are having some kind of conversations with their employees about vaccines. Frequently, these are informal conversations, but for 56% of respondents, this includes formal dialogue like staff meetings. Again, here we note that a greater share of the AAPI, Black, and Latinx small employers are engaged in formal dialogue. Most small employers intend to get vaccinated themselves. Overall, 80% of small employers report their intent to get the vaccine. This compares favorably to analysis from the Pew Research Center during roughly the same time frame that suggested that in the general population, about 69% of people intend to get vaccinated. As you see here, intent varies by race and ethnicity of the small employer, with 90% of AAPI business owners in our sample reporting that they intend to get vaccinated, compared to just 2/3 of Native small employers at the lower end. Small employers not surprisingly, are likely to then encourage their workers to get vaccinated. 63% of small employers overall said they're very likely to encourage their employees to get vaccinated. And as you can see, again, AAPI small employers are most likely at 77%, followed by Latinx at 66%. So if the majority of small employers are likely to encourage their employees to get vaccinated, what are they willing to do? About half all the small employers in our sample said they were willing to provide educational resources to employees who had questions about vaccines, rising to 57% among small employers. 45% of all small employers in the sample said that they're willing to give employees paid time off to get vaccinated, rising to 54% of AAPI small employers. And finally, 14% of small employers across the sample said they were willing to provide financial incentives for employees willing to get vaccinated, rising to 19% of Black small employers. Many small employers, like the business owners you'll hear from in a few minutes, are already engaged on vaccines and other dimensions of the pandemic response with their local health departments or their chambers of commerce. But more than 1 in 4 small employers told us they are not currently working with either of those or any other trusted organizations, but they would like to be. This number rises from 27% overall to 37% among Black small employers. We and our partners see opportunities to help small employers use their voices and trusted status with their employees and communities to promote vaccines and get back to business. We're glad to share these findings and launch this initiative at a moment when constraints on vaccine availability have been addressed, and the Biden-Harris administration is ramping up efforts to promote vaccines in every neighborhood and every community across the country. And we've assembled a terrific group of small business owners to share their experiences and bring the survey data to life. So with that, let me hand it back to you, Renee.
Thank you so much, Tammy. Well, that was a lot of great information, and I'm pretty sure everybody wants to know more. So please stay tuned, because the results of this survey will be posted and we will be sending it out. It will be on our website. So there's more to come. Our next speaker is the amazing Christina Shockey, counselor to the Secretary for Strategic Communications of the U.S. Department of Health and Human Services. Christina?
Thank you so much, Renee. It is such a pleasure to be with all of you today. I just have to apologize from the onset. Starting right at 2 o'clock, a massive construction project seems to have just started right outside my house. So I'm just going to speak very loudly, and I apologize for the noise. I hope it's not too disruptive. But thank you so much for letting me join you today. As Renee said, I work for the Department of Health and Human Services for the Biden administration. I lead our COVID-19 public education efforts. And Tammy's survey was such a perfect lead in to what I wanted to talk to you about today. I am so appreciative of your time, because we have just launched a program as part of our public education efforts that we would love for you to be a part of. And Tammy's research findings about how important small business owners are as trusted messengers in their community is the absolute reason that we would love for you to be a member of what we're doing and for us to work closely with you. I thought I'd start today just by giving some very quick updates about the work that the Biden-Harris administration is doing to supply vaccines to neighborhoods across the country. Yesterday, the White House Task Force on COVID-19 announced that in the last 7-day period, we are averaging 3.1 million shots per day. 40% of American adults have now received at least 1 shot, and nearly 1 in 4 adults are fully vaccinated. So as you know, from day one in the Biden-Harris administration, it has been a priority to improve the supply of vaccines and access to make sure that every American can be vaccinated. The president also announced a commitment for 12 new mass vaccination sites in high-risk communities. Today, President Biden is going to be visiting a mass vaccination site in Virginia, and we'll be making an announcement that he is accelerating the date by which all Americans over the age of 16 will be eligible to April 19th. His goal was previously May 1st, He's accelerating the goal for all states to make everyone in America over the age of 16 eligible to get the vaccine on April 19th. That is due to the improvements in supply and access that have taken place since he became president. And this is a really important milestone for us and that the president will be announcing today. What I wanted to talk to you about is our public education efforts. We have 3 goals that we are working on. The first is to educate all Americans on how to slow the spread of COVID-19. We have been working really hard since the Biden administration took office to really educate Americans about how to slow the spread. We are also working to build trust in the vaccine. We know that the way to overcome this pandemic is to get Americans vaccinated, and we need to build trust so that people are ready to get the vaccine when the supply is there for them to receive it. And we're increasing awareness of how to receive it. We know many people who want to receive the vaccine don't know how to do it. And so we are working to educate people on how to do that. Tammy's research was a perfect lead-in because what we know from all of our research is that we are doing many things out of the Department of Health and Human Services to educate and reach Americans. We've paid ad campaigns that are out in 8 languages. But the most important thing we are doing is empowering trusted messengers in neighborhoods all over the country for them to reach out to their neighbors, to their customers, to their worshipers, to talk to them about vaccine confidence. And so on Thursday, Vice President Harris and Surgeon General Vivek Murthy announced the newest part of our public education campaign, which we are calling the COVID-19 Community Corps. This is a coalition of organizations across the country that want to receive information from scientific sources, from the CDC, from the FDA, from HHS, with the latest information on the vaccines and tools and resources so they can talk to their customers, to their employees, to their neighbors about the vaccine and why to receive it. We started when we made the announcement, when the Vice President made the announcement on Thursday about the Community Corps, we had 275 organizations join us. We now have over 4,000 that have agreed to join the Community Corps and be a part of our effort to receive information that they need in order to be trusted messengers and reach out to their customers and their neighbors about the vaccine. We wanted to ask you if you would join us in this effort. The way to join us, and we'll send out information afterwards to Rhett and Renee, but is to go to wecandothis.hhs.gov, and there is a sign up there and more information. But what we want to do is provide as much information as possible to help you be that messenger to your employees and to your customers. We know, and Tammy's research showed, how much people want accurate, timely, scientific information about the vaccine. We from HHS will be providing to our Community Corps members every week a package of information that has the latest scientific information, the latest research, the latest talking points, social media suggestions, infographics, resources from other Community Corps members for you to be able to have everything that you need to reach out and be that trusted messenger. We know it is the most important thing that we can do to overcome people's hesitancy and build their confidence about the vaccine, from them to hear from small businesses and other trusted leaders in their community. So the COVID-19 Community Corps is our way to be a resource to you to be able to do that work. We would love for you to join us. And so today I wanted to tell you about the effort and really ask you to be a member of the Community Corps. We are so impressed with the work that you are all doing. We want to be a partner to you and be a resource to you to help you do that. And so we would be thrilled if you would join us in this effort.
Wow, thank you, Christina. That's amazing. And one more time, what was that web address?
It is wecandothis.hhs.gov. I will say that our overall campaign for the Health and Human Services Department is We Can Do This. That is our rallying cry for the Vaccine Confidence Campaign, to really encourage people that together we can do this. So if you go to that website, wecandothis.hhs.gov, it will give you all the information about the COVID-19 Community Corps, and we would love it for you to join us. We'd love it for you to be a part of the coalition that's doing this work in neighborhoods across the country and to be trusted messengers to your customers and to your employees. And we would also love to highlight your work to other core members. So we really encourage you to become a member and help us, partner with us in this work.
Wow, Christina, thank you again so much for spending some time with us today and actually say that we can do this because together we can.
Yes, thank you so much. Thank you so much. And Tammy, thank you for that incredible research. That was a real learning for us.
Thank you. Awesome. Well, now we're going to move over to our amazing panel with some small business owners that are doing some great things in their local communities and leading. They're being some great small business leaders. And first, we're going to introduce you to our moderator, Shondell Newsom, who's the founder of Some New Marketing in Las Vegas, Nevada. Shondell?
Thank you so much, Renee. And, just like what Christina was talking about, we are very excited about some of the opportunities to spread the word, build trust, and increase awareness in Nevada, especially for the Black-owned businesses, because, Black, African businesses here feel a responsibility to their community and to their employees to help build on a campaign. The campaign we're doing here, I love We Can Do This. That's a great slogan. Our campaign is all about back to life. This weekend we obviously, for me as a Christian, it was Easter Sunday and the resurrection, and we brought our families together. Definitely kept wanting to have that interaction with our children and grandchildren. And that's an important part. So we're talking about back to life, back to church, back to school, back to work, all of those great things. So I'm really excited to moderate this panel. So I'm going to go ahead and introduce some of these amazing panelists, because this is exciting. I've spoken to these folks and they have some great stories in their own right. We have Ginger Torres from PPE for Navajo First responders out of Phoenix. We have Cindy Ramos Davidson, the CEO of El Paso's Hispanic Chamber of Commerce, and then Mas Torito, family-owned small business owner, just like my family-owned business, Kokoro Restaurant in Denver, Colorado. We have Patty Gentry Young, who gave us some beauty tips in the green room. We love that. She's the owner of Young Hair Salon in Springfield, Ohio. And Debbie Woods, also with Young Hair Salon, the sister combination out in Springfield, Ohio. So welcome everyone. And I'm going to ask you to unmute as we and turn your cameras on as we start going right into the questions, because I know we have a lot of questions, but more importantly, we want to get into a dialogue with those who are listening right now. So the first question is this: why did you as a small business owner commit your time to this work, specifically helping your employees and or your community learn more about vaccinations or provide them with opportunities to become vaccinated? Let's start with the sister combination over at Young Hair Salon and tell us why did you commit your time to do this work?
Well, we do a lot of work in our community, and I am the founder and president of a group called Sisters United for Prevention, which is cancer prevention in the minority community, where our mortality rate is higher, and we're losing a lot of minorities because of lack of education on it, and didn't know a lot about the awareness. But we've been in this organization for 16 years, and I know we help save lives. So when the pandemic hit, we talked with to schedule an appointment. Is Patty Young, can you help us with minority community? And of course, yes, we can. So they wanted me to help schedule appointments for minorities. And me being busy, I couldn't, but my sister, who's my receptionist, she jumped right in. And, we have clients that come in and out. We were telling them to make sure you get your vaccines. And minorities were 2 times higher than anybody else. We were losing each other. We lost friends, family, and we just wanted to help. So Debbie jumped in and does the scheduling, and we've been able to, again, save lives.
That's awesome. That is so phenomenal. Cindy, what are you doing over in with the Hispanic Chamber of Commerce?
Well, thank you for that. We're trying to be, lead by example for all our businesses. And I love that quote by Maya Angelou that she says, we're trying to just be a rainbow in someone else's cloud, because that's what's really happening out there with COVID. We're trying to make sure that ourselves critically safe and leading by example, and the ability to stay safe and stay open, to be able to provide support to the marketplace, to be able to better have them understand what's going on, because they're getting so many things and they're really stressing because they're about ready or have lost their business and they have to revamp it and retool it, and they need a lifeline. And so we're hoping to continue to be that leader in their lifeline in teaching them what we call mask up, open up, and consider getting vaccinated to get close up. I mean, that's what we're trying to do.
Oh, I love it. I love it. And Ginger, I know you have a great story. I heard yours. So why don't you share with our viewers what you guys are doing with the Navajo First responders?
Thank you, Shondell. As most of you probably know, the COVID pandemic hit communities of color hard, but especially tribal communities. At the peak of the crisis COVID-19 rates, and the Navajo and White Mountain Apache reservations were 7 to 10 times higher than the rate of Arizona. I'm Navajo, and even though I live off of the reservation in Phoenix, I saw firsthand how COVID devastated my tribe, and I wanted to work to stop the spread by founding a group called PPE for Navajo First Responders. We provide PPE supplies free of charge to first responders and essential workers on the Navajo Nation to help stop the spread of the virus. And ultimately, our goal is to help save lives. In terms of the vaccine rollout, there's been a lot of fear and misinformation that's being shared amongst tribal communities, which is making a lot of Native people hesitant to get the vaccine. And so I'm really working to build trust and increase awareness in tribal communities, and to help Navajos and other Natives overcome this fear and misinformation. I've partnered with one of the largest nonprofit COVID-19 relief organizations on a social media campaign to encourage tribal members to get vaccinated. We're doing stuff like highlighting testimonials from Native influencers and leaders and heroes and their personal reasons for getting a vaccine. Many of the testimonials address a desire to protect loved ones and tribal traditions and culture and languages that would be lost if our elders are lost to COVID-19. So my hope is that our social media campaign will encourage everyone on the Navajo Nation to get a vaccine while still adhering to CDC guidance, and help even put an end to the COVID-19 pandemic.
Great. Thank you so much. Look at that. All that diversity. Everybody's putting in a great effort. And this is not last but not least, but this is my man Mas, family-owned business. Tell us what you're doing out there in Colorado.
Yeah. Hello, everyone. Thank you, Shondell. Yeah, I'm a second generation small business owner. My family started our restaurant, Kokoro, in Denver over 35 years ago. And the reason why we're helping as much as we can, both in the community and for our employees, is because it's just what we know we've needed to do since the pandemic started. Everyone's come to us for questions about, can I come to work? Or I have a headache, should I be coming to work or not? Or can I see my family members? Or all sorts of questions that they didn't feel like they were having the resources or answers to. And I found that we were that main source for a lot of people's information. They felt it was objective. And they all know that we care about them. We have plenty of employees with us for over 20 years, 30 years. They're part of our family. So we knew that we needed to take care of them, get them vaccinated as soon as possible, and have them help outreach to our customers and other community members to do the same. It is a really hard thing to hear a clear message through all the noise that there is out there. And I think for us, being able to provide resources as to where, when, and who can help has been key to help get people vaccinated.
Well, thank you so much. You know, it's interesting that we all have, we're all doing different things, but even with all the work that we're putting in to communicate and talk to people, there's so many stories going around, right? My wife and I went and got our vaccines last week, or a couple of weeks ago now. We're going back in around on the 15th to get our second shot. And when we came back to our office and everybody's like, what? You guys did it? What? I want to see how you turn out before I go get my vaccine. So I want you guys to talk a little bit about that. We know that many communities have felt differently about the COVID-19 and the vaccinations, from healthcare disparities to cultural insensitivity and mistreatment from the healthcare system that has treated many to feel unsupported and untrustworthy. And I know earlier we talked about building trust. As a small business leader, what are some ways you have work to address these barriers in your community? What are some areas are you still facing in this space as challenges? I'm going to kick that over to Ginger first, because I want to hear what are some of the challenges that are happening.
So early on, there was a range of compounding factors that contributed to the disproportionate rate of spread on the Navajo Nation. Just to give you an idea, the Navajo Nation is 27,000 square miles, which is larger than the state of West Virginia. And small towns are spread apart by miles. And so it's difficult to get basic supplies. What factored into the spread of COVID-19 is that tribal hospitals are historically underfunded and under-resourced, and were therefore unprepared to handle the crisis of this magnitude. There is a prevalence of pre-existing conditions that, such as diabetes, obesity, and heart disease, that can increase complications from COVID-19. There is also limited internet and phone service and electricity and running water. And all of these infrastructure issues make kind of like following the CDC guidance even harder for tribal communities. And on top of all that, a lot of tribal communities and residents live in multi-generational families. And so it makes it very hard to isolate a family member in that situation if somebody does become ill or infected, and thus the virus spreads throughout the family, and most of the times it's the elders that are most affected. And so because of all these reasons, Navajos and Native Americans in general at the same time are extremely hesitant to trust the government, even when it comes to something like a life-saving vaccine. And even this week, I saw a PBS report of CDC data where researchers found that American Indian and Alaska Native communities had the highest death rate per capita of all races and ethnicities due to COVID-19. And so in response to the pandemic, Native communities and organizations and activists and leaders have come together to help each other at the grassroots level. And I think that's what's really contributed to providing kind of the trust aspect of the peer-to-peer connections and knowledge sharing. And so I mentioned earlier that I have partnered with a COVID relief group to develop a COVID-19 social media campaign to encourage vaccinations. And through that, we're trying to get at the younger generations especially of the intergenerational households, because the younger generations, like the young adults, are the ones that are leaving the household more frequently and have the potential to bring back the virus to infect the family. And so it's really important that we reach these young adults, especially through social media, to help them and encourage them to get the vaccine, to protect their elders, to protect their households, and communicate to them that public participation now in controlling this pandemic is as easy as getting a vaccine, as opposed to all of the stay-at-home directives that were issued earlier. Now it's go get a vaccine to protect your family and your community. So our elders and Native communities are the keepers of our traditions and our cultures, and they hold our languages. And so it is vital in Native communities to stress the vaccine. And I think a lot of communities are starting to understand this. Navajo Nation has over a 50% vaccine rate at this point. And so it's looking bright, but as long as communities can continue to take the CDC guidance to protect each other, I'm hoping that everything can get under control and back to normal soon.
Thank you. Cindy, what are you hearing? I know I work with a lot of Hispanic partners out in Nevada and Las Vegas in particular. We have very large population. What are some of the fears, and how are you handling those?
Well, there's still fear, facing the fear of unknown. I've always kind of said, stop being afraid of what can go wrong and start being more positive about what can go right. That's a little easier said than done. In our market, language barrier has been an issue in terms of the miscommunication. So we're very fortunate that we're able to do what we do in training and educating in Spanish and English. But the fear factor of unknown of what's in the vaccine, and I love the idea of being able to get more of the scientific stuff, because we are culturally Hispanic in our market, 82%. You have the religion aspect of one of the vaccines in terms of one of the components having fetal parts to it, and that is an absolute no, and they're not going to do it. So trying to get more of that scientific information of what goes into the vaccine so that we can continue to play a key role in communicating, educating, and informing. We're doing a lot of training and webinars and a lot of one-on-one counseling and showing other businesses that are doing what they need to do to get the vaccine. But it is about the fear of the unknown and what's in those vaccines, and us being able to better communicate through the healthcare professionals in both English and Spanish about the importance of protecting customers and employees.
Thank you very much. Mas, what are you doing in Colorado? How are you overcoming those objections and those challenges?
Yeah, it's definitely a challenge. I think there's a number of issues, one of which is language. In the API community, there's a number of different languages and smaller communities, especially here in Colorado. So reaching the smaller pockets, so to speak, of populations that are many times being ignored, it's a real hard thing to do. So we try to bring people together, provide links, have people call on behalf of other people, sit side by side, of course, with masks and 6 feet as best as possible, but walk people through the steps of getting appointments. And that's part of what the challenge is here, is that having to set up appointments, limited locations, limited availability, all make it hard to get people vaccinated. So the mass sites have helped, different community outreaches have helped, but they're still counting on us small businesses to help them out.
Great. I'm going to go to the sisters now. I know in my barbershop, there's always rumors and gossip going around. I know the same thing happens in the beauty salon, because sometimes I stumble across it with my wife. So you guys tell me, how are you handling that? And what are you doing to manage that, the rhetoric, and what do you do to help people come back to science?
Well, there's a lot of trust when you think about the Black community. To talk to a lot of them don't really realize it's a vaccine that's not just one for us and one for them. We all, come out of the same pot. So a lot of the things that they worried about, the Tuskegee Institute's experience, the Henrietta Lacks event that happened. So you hear that a lot. They throw that at you, I don't trust. Well, here at the salon, we've all been vaccinated. We've all had both. And we all know people that didn't win the battle. We know people that were really, really sick and came through. But it's such a fear. You're better off just get the vaccine. You get the vaccine, you don't have that worry. So we're all doing that. And then with my sister scheduling appointments, they feel better when you talk to somebody of color. When they call to schedule an appointment, they can ask her questions that you just couldn't ask anybody else. And Debbie could tell you some of the things she hears. First of all, they want to know if I've had mine and what was my experience on getting my vaccine. And then they also, what I have been finding, they have a hard time going online to schedule their appointments. So what I did, I went to social media and put information on how to contact me to get scheduled. And then also everyone that comes into the shop, I stop them and make sure they've had their vaccine. And there's been times, you know, where they don't think they should get it, their health isn't that good or whatever. I ask them to talk to the physician to make sure they can get it. But when people come in, I make sure they are scheduled. And then once I put it on social media, my phone starts ringing. I even put my home number on, my cell phone number, and here at the shop. So there's been times I'm up till 9 o'clock scheduling people for their vaccine because once they see it on social media, they spread it to their family, they spread it to their friends. So yeah. I've really been busy scheduling people.
Well, you know, that's great. You know, and you just talked about a lot of commitment. There's a huge commitment when it comes to being in leadership, right? So let me start with you this time, Cindy. What is one way you would tell other small business owners who are on this call, who would like to become leaders in this space? What is their first step? What would you say is their first step?
The first step is just go do it.
Go do it.
Just go do it. Yeah, use the practices that other businesses are using and have them take their own spin on it. It's kind of like what we did. Be creative with your message. That's why we have the MOVC strategy, which is mask up, to open up, and consider getting vaccinated, to get close up. And I think businesses can do that and have the will to do that. Growth is never really mere by chance. It is the result of forces working together. And there are certainly a lot of forces just like this today working together to help businesses just go do it.
I love it. Mask up and open up. I love it. There you go. I'm gonna go back to the sisters real quick. How would you encourage somebody to take a leadership role like you guys are doing? They want to stay up and make it happen. What would you tell them?
Well, one of the things we've done here was to help our community health department get involved in the Black churches. And lived here all my life, I knew a lot of ministers, churches, and that was a big help to do it that way. But if we want to get back to any sense of normalcy, and if we want to be around our families and our friends and socialize, everybody has. This isn't just businesses, everybody. If we want a normal life again, we need help from everyone.
Thank you so much. Let's throw it to you, Ginger. How will you encourage others in that role to be leaders?
I would say one opportunity to consider is getting involved in local leadership organizations that are focused on finding innovative solutions. This has the advantage of allowing resources across regions to be pulled together to maximize the benefits of investments, and resources can be directed to where they are most needed at that time. So early in the pandemic, it was towards finding masks, finding PPE, finding face shields. Now it can be towards, organizing vaccine clinics and that type of thing. Joining with another network of business leaders, my husband and I have been able to kind of get together with people across the state of Arizona that are interested in working towards similar goals to help what we can do, help in ways that are possible for us to end the pandemic, so that our businesses, our schools, and our economy can safely get back open. And also, I just wanted to highlight that I think it's important to communicate to employees and the public that one of the benefits of getting vaccinated is that it creates a freedom from worrying about the worst case scenario should a family or elder become ill with COVID-19. It gives peace of mind. I think Patty mentioned that earlier. It gives a peace of mind and eases up some of the stressors, which allow us to be better parents, better friends, better employees, and better bosses. So those are my suggestions.
Great. So those are great suggestions. I think I got everybody except Mas. Mas, go ahead and you answer that question and tell me what would you encourage people to do?
Yeah, I would say, I don't know if this sounds a little bit too aggressive, but I would suggest them seeing it as their duty, as their responsibility. not just as an option or a pat on the back kind of thing. Just like you have to pay your taxes and follow health department guidelines, doing everything we can to help our employees and our community get vaccinated should be seen as an obligation. I think that's the first step. Second step is the resources you use for other aspects of your business. Like for a restaurant, the National Restaurant Association has great resources that they put out weekly or every couple of days even. And our local restaurant association has been great. They've sent out emails without requiring people to join. Chambers of Commerce have been great. There's just a number of organizations that have really been available. And just to start with that. And then another small thing is, as small businesses, I'm sure a lot of us all get hit up for donations and requests to participate in community events. Every single one of those that comes through, ask the question, hey, do you have any suggestions on how I can get my employees vaccinated? Or is there anything we can do to help your organization get people vaccinated? And just reaching that out and having that be part of the hello, thank you very much, have a good day. If you add that question in, what can we do to help? It's amazing how quickly you can find yourself in the leadership. And that's how I found myself here. That's how I found myself part of this panel, is just doing the same thing.
You know, that's interesting because I always say that too. I'm like, I could be doing a lot of other things, but you know, when you're called to lead, that's what you do, right? And so, you know, at the Urban Chamber here in Nevada, we're doing the same thing. We're just calling out our small business owners, giving them the tools so they can go out and talk about vaccinations. But we got a question from Paul Hollowell, and he's saying, I'm offering paid time off plus a cash bonus for each employee who receives the vaccine. I've also shared with them my experience as a recipient of the vaccine during the trials. Even still, none of my 15 employees have been willing to make an appointment. What else can I do? Who wants to take that first?
Well, I will.
Looks like Cindy chimed in.
I will tell you what we did with what I did with my team. I was very afraid to take the shot myself. I was listening to everything out there and I thought, oh my God, at my young age that I look at, right, 65, I'm going to die. I mean, that's what I thought. But then as I thought about it and read more, I realized I got two options: take the shot and get a little sick, or really do die, because those are the only options. And so maybe I get a little sick on this side, but on this side, I'm never going to come out of it. And it's all about how you look at it and how you help motivate your employees to have the right information. Yes, incentives are great, but it's not always about the paid time off. It's not always about the cash. It's really about what they're hearing and what their other peers are doing. And so it's like, get other people in their lifeboat with them. It will help encourage them to do it. Ultimately, it's their choice. They do have a choice to do it. Religion sometimes plays a case, like in our market, religion has been part of that, which has been something you don't challenge. But I got to tell you, it's faith, faith, and more faith. And if the Lord didn't want this vaccine to be here, we wouldn't have had it. That's just kind of how I look at it.
All right, praise him. Look at that. We're going to church with you now, Cindy. All right. I love it. I do have another. Anybody want to tag on to that one? Because I got another great question. Okay, so I'll move to the other one. So this one, who's this? Amy Baxter. This one comes from Amy. Do you have resources for the 28% of the adults who have needle fear? Okay, needle fear. 10% of those are 60 plus, 60% of those in their 20s. Needle fear is real, especially in communities of color. How do we have the conversation about the needle fear? Anybody want to take that one?
Well, I can chime in. I can tell you firsthand, I was a kid. I used to run out of the doctor's office every time they came with the shot, and they used to have to go and get me with my britches down. I kid you not. But as I got older, I realized it's just a pick. That's it. And I would close my eyes and think about my mother just giving me a pick, and the fears went away.
Oh, my wife is a scaredy cat, so I could tell you right now, she went and got her vaccine, and that made most of my employees go, "Wow!" I saw you wanted to chime in too, Patty, and then Ginger.
I had one of my clients came in and she said she had a fear of the needle. She didn't notice that when they watched someone get their shot on TV, nobody flinched. So I said, well, it is an awful small needle. So, they said, that's what scared them. The needle was long, but still like people flinched. And the other thing is, I have a great grandson that was born in the middle of the pandemic, and I could not see him for a long time. And then when I did see him, I was all covered up. So now that I am fully vaccinated, I can actually hold him, kiss him, and be the grandmother. And all the other thing is, all of these young people that are afraid to get the vaccine or won't get it, I have a girlfriend whose grandson was very, very sick, where his parents didn't know they were exposed, but he had been exposed and got very sick. So do it for your grandbabies and your grandparents. You know, what's a shot when we think about your life?
Thank you. Ginger, you had something to add to that?
Yeah, and just to piggyback on what Patty says, she has a lot of great information. I did want to mention that I was also afraid to get it. And once I did, I didn't even know what happened because the needle, I could not even feel it that much. And so I think that's just a word of mouth type of thing, is just sharing with people your personal experience when you actually receive the vaccination, that it didn't really hurt and you don't have to look when it does, or you can, hold somebody's hand. But also that it is important to remind ourselves why we kind of go beyond our comfort zones, and those important reasons that Patty mentioned, like our, grandparents being able to hug grandchildren. My children have not seen their grandparents and hugged their grandparents in over a year. And so just those baby steps that we can take to get back to that point are so important. And those are motivational factors for going out of our comfort zone to get that vaccine.
So I just want to, Mas, I got a good question for you coming up. Listen to this one. So L. Holden says, I only have 4 employees and really can't afford to give paid time off or cash incentives. Are there any other incentives for employees that you've used or that you could think of?
Free food, movie tickets, you name it. And you also have to consider the alternative about national and local paid leave laws. If you have someone get sick and they're out, you have to provide, pay for them when they're out. So you really take the risk on the other hand too, of how much that's going to cost you. But I think a 2-hour paid amount of time to take off to go get a shot is something that's reasonable. I found it very effective with my employees. Hey, we're going to just add a few hours to your pay for the time you need for that. And then the next day, we'll make sure that at the very least, you're scheduled off from having the shot, so you don't have to worry about losing work the following day. We'll stagger the staff in such a way that it's not something you have to worry about. But yeah, just about anything. Preference on the following week's schedule, you get top priority of what shifts you want to work and what shifts you want off. I mean, there are a million things employees want that are just small little cookies that can sometimes go a far way. And just real quick on that last question about people with fear of needles, 2 things I would point out. 1, try to get 2 people to go together. So that way the person who doesn't have that fear gets the shot first and says, hey, that wasn't so bad. I think trying to get 2 people to go together will help with that. The second thing is it's not a blood draw. So sometimes people have fear of the needle because they're worried about how they get pricked for their veins rather than just a shot in the arm, which is so much easier and simpler. They just need to be educated. That's a very different kind of shot than when you go for surgery or anything else.
Well, guys, you know what? This has been wonderful. Believe it or not, our panelist time is like gone that fast. You guys were amazing. It was great talking to each one of you, your different perspectives. I am actually blessed to be the moderator of this exciting panel. Thank you again, Cindy, Ginger, Patty, the sisters, who else? Mas. I'm so grateful. Thank you to Rhett, and thank you to Renee for this opportunity. You guys have been amazing, just amazing, and have great information. Keep doing what you do in your community. I'll pass it back over to Renee, and we can wrap up.
Thank you, Shondell. And thank you to our amazing small business owners. That panel discussion was just so amazing and also so encouraging, right? Because what I saw in the Q&A, and I think many of you also did, was hear of so many opportunities of what so many of you can do in your own local communities and your own small businesses to help with getting your employees, getting your community, getting your families vaccinated. And in order to do so, we are launching this amazing resource tool. You can go to www.reimaginemainstreet.org/vaccine-resources, and you can see all these amazing tools and toolkits you can use to help with doing this work and being the amazing small business leaders that you are in your local communities. There's all kinds of tip sheets, guides, resources. And again, as we mentioned on the top of the call, they're in different languages. So it is great. It is amazing. And of course, more will be coming as the weeks go by. So take a look at this today and use this to help with your community, because when we all work together, we're stronger together. And as Christina said earlier, we can do this, right? We are all in this together. And it's all about us working together to making sure that we can open up and making the economy getting back to where we once were, where we're all thriving and doing what we love, which is making our businesses thrive. We want to thank you all so much for joining us today. We know that there's a lot going on, and there are a lot of things you all are trying to do to make your businesses thrive during this time. So we appreciate the time you spent with us. We want to thank all of our amazing speakers, all of our amazing partners on this that worked with us to this event today. If you have any questions or if you need any additional information, please email us at rms@publicprivatestrategies.com. Again, thank you to all of you for signing the pledge. And if you haven't done so, please sign that pledge as well. Want to say thank you again and have a great afternoon.